54,000 cases in our last 24-hour reporting period. Some of that may reflect changes in reporting, as there was a lag and the change in the systems reporting, I believe, from the state level. So some of that is potentially architectural. But if you look at the number of cases over the month of June, they've remained relatively stable. What you see is a kind of a stable weekly pattern, a decrease at the weekends. And it's not that the disease decreases, reporting changes, but there certainly has been a spike in cases in the last 24 hours. And again, we're looking into how much of that is artifactual or related to reporting and how many days that reflects going back over the last week. Because on Wednesday, Thursday of last week, the number of confirmations from Brazil was actually below average. And now we have a very much an increased number, which may reflect it's above average. So we're looking into that with our colleagues at the Pan American Health Organization, our regional office for the Americas. The states with the highest number of cases are still Sao Paulo, Rio de Janeiro, Sierra, Para, and Maranhão. And the number of cases at Sao Paulo are approaching 212 million, or 212,000. I'm sorry, but there still is relatively low tests per population, and the positivity rates for testing are still quite high. If you look overall, in epidemiologic week 17, I believe the positivity rate was 31% for Brazil. So that generally means that there are probably more cases out there than are being reported. What we tend to see is that positivity rate dropping, usually down to 5% or less in countries that are detecting all of their cases and that are in effect over-testing. So from that perspective, we would say that this trend or these large number of cases are not reflective of exhaustive testing, but as I said, probably underestimate the actual numbers of cases. So while the overall pattern of disease in Brazil, as I said last week, is overall flat, the number in the last 24 hours needs to be examined carefully, but also we need to look at the fact that, as I said, up to nearly 1/3 of all tests are positive, which does indicate that there is under-detection or under-reporting of cases overall.
If I could just add to that, it's not specifically about Brazil, but when we look at any case numbers in any country, it's really important that we break this down to the lowest administrative level as we can. The virus doesn't take hold evenly across all countries. There may be differences in intensity of transmission by a state or a province, but then even more importantly, it's to break that down even further. Where is transmission happening? Is it happening in healthcare facilities? Is it happening in these expat dormitories that I mentioned previously? Is it related to specific events? Is it in certain vulnerable populations like long-term living facilities? We need to break down the cases to an understanding so that we know how to tackle it. And when we look at the national level, it's very important to have that national number, and Mike has outlined some of the reasons we may see some differences, but we need to break it down and understand where transmission is occurring, because this will help us control it. You've heard us talk before about these 4 C's, where we go from no cases to sporadic cases, clusters of cases, and community transmission. And what we're aiming to do with the testing and isolating and caring for cases and contact tracing is to bring transmission down from community transmission to clusters. And once we understand where those clusters out, to bring those under control and move that back down. And so as much as we can, and this may be very difficult, especially in countries that are experiencing community transmission, is to really break down our understanding to the lowest administrative level as we can, and use our resources where they need to be used most intensely based on that epidemiology.
And if I could add, Tarek, because I answered the question directly in relation to Brazil. I don't want anyone to get an impression that I've singled out Brazil. If we look at Latin America in general, Brazil, if you count those numbers, the increase in numbers reported yesterday has about a 25% increase overall on the week. But if we look around the region, Chile has had a 41% increase in cases in the same time. Argentina has a 38% increase, Colombia a 35% increase, Panama 26%, Bolivia 33%, Guatemala 39%, Honduras 38%, French Guiana 86%, Costa Rica 28%, El Salvador 24%, Haiti 26%, and Venezuela 25%. So what we're seeing is still in Latin America is an evolving epidemic in the region that's affecting all countries. And certainly Brazil, as the most populous country, is deeply affected, but it's amongst many others. And we've also seen worrying increases in deaths in the same period in some of those countries. So from that perspective, I think it's important to see Brazil in its regional and in the global context. Just to be sure that people don't misinterpret that in responding to a question specifically on Brazil, that we're not conscious of the regional or global context and the place that Brazil sits within that.
Many thanks. We will take our last question for today. We have Pian from NPR. Pian?
Hi, thanks for taking my question. There are reports of minks being culled on a farm in Amsterdam over concerns that they could be an animal reservoir for the coronavirus. So I wanted to ask, what do we know now about animals and humans transmitting the virus between them, and how does that inform our approach to suppressing the virus?
So thanks for the question. Yes.